All right, Gerald. Well, thank you for coming in today. And I know you have written down a brief patient history for me. Sorry. And I was wondering if you could kind of tell me, sum it up, and just tell me about yourself.
Yeah, absolutely. Uh, my name is Gerald. My nickname is Dusty, and I'm from Lake City, Iowa. I've been doing general labor my whole life. I did not graduate from high school. I did carpentry and construction for most of my life, so it was very labor taxing. I've had a history of Parkinson's for the last 15 years and been depressed off and on for the last 20 to 25, and I have been hospitalized twice for this. Right now I am in the nursing home with kidney failure and still suffering from depression, anxiety, and Parkinson's. I do not live a healthy lifestyle. I'm about 350 pounds, so it's been a long time since I've walked. I also, since I haven't walked, I have ulcers on my buttocks,
Okay.
causing pain.
All right.
Currently, I'm taking 5 medications: mirtazapine, corbidopa / levodopa, sertraline, metoprolol, and oxycodone.
All right. And what I really want to describe with you today, or talk with you about today, is the adverse drug reactions that the drugs that you are on have with each other. And by no means, I'm not telling you not to take any, but I would just recommend that you talk with your medical physician, your MD, or whoever prescribed these drugs for you, about the adverse effects between the following drugs. And I'll walk you through them right now. And I'll hit out the highlights of things where I think some of the stuff is maybe overprescribed or for several things. So, for example, if I look at your oxycodone, which is an analgesic you're taking for your pain, some effects of that, adverse effects with the other drugs you're taking, specifically the sertraline and mirtazapine, which are both antidepressants. You have double dosage of there, and those have some pretty serious side effects with oxycodone. For example, the sertraline and the oxycodone. The sertraline increases the effectiveness of oxycodone, so it's also why you're also so tired. That could be an example or a reason why you're always sleeping.
So these are kind of building off each other?
Yes,
Okay.
exactly. And so sertraline is increasing the effectiveness of oxycodone. And oxycodone also has an effect with the sertraline, kind of a two-way street, positive feedback system there, that it's increasing your chances for a serotonergic syndrome, which is the increase of having too much serotonin in your system, which is highly lethal if you were to go that far, I guess. And also, to talk about your other antidepressant, mirtazapine. That's also has an increased sedation rate with oxycodone.
So that would explain as to why I've been tired all the time.
Exactly.
Okay.
And there are also some, I have a handout here for you that kind of explains some of the other non-serious interactions between the drugs that you're taking. And by no means I'm not telling you not to take these, but I would just highly recommend you consult your healthcare physician about these, especially the oxycodone and the sertraline, because you're taking a double dose of antidepressants here, of the sertraline and the mirtazapine, and both of these antidepressants are having adverse reactions with oxycodone.
Okay.
And I mean, I don't know how far along, and I don't know all the biochem behind it, but if you could just bring in, say, this sheet that shows from this journal, bring it into your healthcare physician and confront him about it, ask him about it, see what he thinks. If he thinks you need to dial back some or not, we can work from there.
Okay.
And some of the stuff we want to talk about here is what we can do for recommendations for yourself, because you're pretty, I mean, you're sedated, you're sleeping a lot, as you say, and you're not moving all that much. So, I mean, we'd like to set you up with a low glycemic food diet. Eating healthier can make you feel better all the time. And also, we'd like to see a physical therapist, can kind of start to get you out of bed, so help yourself move along, basically. And also, as I mentioned, just see your medical physician as soon as possible. And I mean, it's possible the serotonergic syndrome could happen and at any time because you're taking these pills, you're increasing your body's resistance to stuff. So if you're increasing resistance, or you're having to take a larger prescription, it could lead to this problem, which is highly lethal.
So when this says monitor closely, so that means this is pretty adverse and very significant stuff that should really be addressed.
Yes, they are.
Okay.
And I just hit on the more major ones that I thought were a bigger concern as of now, but I mean, yes,
They all have potential to be dangerous.
Correct.
Okay.
Also, as you've been very depressed when you're taking these double dose of antidepressants here, I would recommend to you that you spend more time with family, just kind of more social interactions, because that'll decreases your anxiety and depression. And
Sounds fairly logical. So when I go speak with my medical doctor, the main drugs you say that I should maybe confront him and discuss with him are oxycodone with sertraline and the oxycodone with mirtazapine. Is that correct? Is that the major one that you're very concerned about?
correct, that is so. And I don't know how much in pain you're in, and if you're taking your oxycodone, your analgesic for your pain symptoms, maybe you could take a lesser dose, say something like ibuprofen or something like that. Or so, yeah, consult him about that.
Okay. And maybe my pain will decrease if I start becoming active.
Oh yeah, of course. And you won't have your ulcers and stuff like that, your bed sores, stuff like that. Is there anything else you want to ask me today then?
No, this is all new information. I noticed after taking more and more drugs that it didn't ever really make me feel better. It might have helped with one symptom, but another symptom would arise. So maybe confronting these with my medical doctor, maybe we can get to the bottom of this and find a different route.
Oh yeah, and very much so. You'll be able to find maybe he has other drugs and other prescriptions that are better suited for you, and maybe I don't know, it just less adverse effects for you. So that's what we're looking for.
Definitely. Well, I'm glad I met with my chiropractor.
Well, thanks. Thanks for coming in today, Gerald.
Thank you.